Hi, I'm Dr. Ashish Gupta. I'm the Chief of Medical Oncology at Unique Hospital Cancer Center in Dwarka, Delhi. When it comes to challenges in oncology in India, I think there are a couple of things. One is the lack of the healthcare facilities. And so we know that there's a rapid rise in cancer cases in the last couple of years in India. And there's still a dearth of healthcare facilities and doctors. Two, I think something that affects almost everybody who's been affected by this disease is cost. Cost is something that people really have to think about when it comes to cancer care because some of this can be very expensive. And the third thing I think is the late diagnosis of a lot of our cancer cases in the stage 3 and stage 4 setting because of inadequate awareness that cancer is a treatable and a curable disease in many, many conditions and cases. And the second thing about this late diagnosis is the lack of adequate screening of cancer. I believe that every cancer case should get a second opinion, right? Cancer is something that is relatively serious, and our best shot at treating cancer, at curing cancer, is our first shot. So there's not much in the ways of going back once you started a treatment or once 3 months, 6 months have elapsed. And so that's why I recommend to all of my patients, please go and get a second opinion. It's very important. Second opinions are also important because cancer treatment is very rapidly advancing. What we've seen in the last 5 years, even the last 1 year, we have not seen in the last 20 years, the last 50 years in cancer, where now we have almost one drug every week that is being approved. Just in this last 2 weeks, or last 5 days actually, there have been 3 new drugs that have come in cancer. One in pancreatic cancer, one in metastatic melanoma, and a third drug. So I think because of that, because there is so much rapid advancement in cancer, is another reason why second opinion is important. And the third reason is because there are many clinical trials that patients may benefit from. And that's something that you can certainly get from a second opinion. One is giving chemotherapy and other therapies before surgery, so something that we call neoadjuvant treatment. Before, it was kind of the norm that we do surgery and then we operate, and then we give chemotherapy if a cancer is operable. But now we've seen in many cancers like breast cancer, giving chemotherapy, immunotherapy, other therapies before surgery helps to make it a smaller surgery and also improve the cure rates and outcomes by a lot. The second thing I think is really personalized care in cancer. Just like we know that every person, each one of us, is made very unique, that's how every cancer is also unique. 20 years ago, we used to think all breast cancer, all lung cancer is the same. Now we know that breast cancer has 3 types, and it's not just these 3 types. Each one of these types also has another 10, 20, 30 different types. And so now every cancer with molecular and genetic profiling, we are finding out that they are in fact very different cancers. And to target these cancers, we have new targeted therapies that have really changed the way that we treat cancer now. And the third rapid development or advancement in cancer is immunotherapy. A lot of our patients also ask us, can I have immunotherapy? It's become a common word in which we're using our immune system to fight the cancer cells. And so I think, this is obviously an amazing time for a lot of our patients where they're living for many, many years longer than ever before. I was lucky to be trained at the world's first cancer center in New York, in Buffalo, New York, called Roswell Park Cancer Center, where I did my fellowship in both medical oncology and hematology. The decision to come back to India was really more of a calling for me. I've seen that there's been a rapid increase in the number of cancer cases in India, and there's a dearth of healthcare facilities, of healthcare doctors. And so coming to India was more of a calling to serve our own country. When I came to India, I saw the differences, having trained there, worked there, and now being in India. And I think we are incredibly lucky and fortunate that cancer care here is really delivered at a very high standard. But there are still some kind of key differences. And I think the main difference is cost. In the US, when a patient is diagnosed with cancer, yes, this is a serious disease in many patients. So, that is a issue for them, but there's not a concern about cost. Ki mera ghar bik jayega, for example, is something we hear commonly in India. And so I think that financial burden is something that unfortunately is a big issue for I would say even most of our patients here. And I think the government has had numerous policy initiatives, even recently, like Ayushman Bharat, that is giving the people these cards so that everybody or most people are now able to afford a basic level of treatment. I know there's been new aims being set up, there's been new cancer centers being set up that are all focused on the same thing. And so I think there is a long ways to go, but we've been certainly making strides in the right direction. I think the private sector also needs to catch up in this regard, so more and more of our patients are able to afford this, and they don't really have to think about the cost when they're making decisions about, will I go for treatment or not go for treatment. So the idea behind Cancer Mukt Bharat campaign, this is a campaign that we started in India, is that I saw in the US that cancer is being diagnosed much earlier because of screening tests like the mammogram, the pap smear, the PSA test for prostate cancer, etc. But in India, vast majority of people are not getting these tests. And so cancer is being diagnosed in stage 3 or stage 4, where it becomes much more difficult to cure and to treat. And so this kind of experience led to the birth of this campaign. And what we're trying to do is to drive awareness, because I think that's what's lacking. Even in families of doctors, families of lawyers, of engineers in India, most people are not getting these tests done at the age of 21, 40, every year, every 3 years. And so I think that's one, and I think this is something that the government, that policymakers should also really drive, because cancer is very curable. Over 80% of cancer, if diagnosed in stage 1 or 2, is curable if found early. And so that was the driving force behind this campaign. Unique Hospital Cancer Center, we follow the latest US-based protocols because that's where I trained. So we follow the same protocols that a patient would get if they were to be treated in the US. And so I think that's one of the differences. The other thing is that the medicines which are now being approved or those that have been recently approved, because I have experience in using those medicines, that's why we're able to better and more effectively deliver those to patients here. And then I think in cancer, something that's very, very important that we really take to heart is that we treat patients here like family. This is a serious disease. It is something that is becoming more and more long-term and chronic. And so what we've tried to do in the overall, from the time the patient walks in to the time that their treatment or their entire regimen of 6 months, 1 year, 2 years, 5 years is completed, is to make this like a family experience. We have a 24/7 patient coordinator who is available over the phone, and so there's not a lot of waiting in lines or on IVR systems to get to help when you need it. The facility is designed and so that if the family is with the patient, there's a comfortable place for them to sit, for them to stay. And we've also, kind of tried to use the latest things in cancer, like using infusion pumps, for example, to deliver chemotherapy. So trying to really replicate anything that you would get in the US. And understanding that cost is a big barrier to cancer care in India, we've also really tried to reduce the cost and to make it very, very affordable.